Welcome to my e-poster, Love and Tourette Syndrome, using a reality show to teach psychiatry. Tourette syndrome is a condition that causes a person to make sudden involuntary sounds and movements called tics. Patients often face discrimination and are misunderstood. Watch a BBC interview clip here to learn first-hand accounts of patients living with Tourette's, and familiarize yourself with common tics by playing a word search puzzle by clicking here. A Love and Tourette class is part of a psychiatry course syllabus for fourth-year medical students in our hospital. It aims to enhance learning experiences, cultivate empathy through reality TV clips, discussion, and essays. It is 3 hours long, and a total of 60 students have participated. This study aims to explore what students have learned in this class. The class started off with Part 1 worksheet, its pre-test qualitative survey with open-ended questions to assess students' knowledge and attitudes toward patients with Tourette syndrome. Then there was clips from a reality TV show that portrayed the challenges of finding love for a man with Tourette's. After each clip, a psychiatrist encouraged students to discuss what they had learned from the viewing, including identifying the types of tics shown. Finally, students were given post-test surveys. They reflected on their learning experiences using an essay. Assignments were handed in anonymously and not graded. I used the students' essays as a source for the qualitative analysis, using reflexive qualitative analysis. Data reached saturation after 22 essays were analyzed. Moving on to results. From students' reflections, four main themes are generated. 1. Increased understanding of Tourette syndrome. 2. Increased empathy toward patients. 3. Positive attitude toward mental illness. And 4. Good student satisfaction. Most students reported increased understanding of Tourette syndrome, both in terms of biological and psychosocial aspects of the condition. They stated that watching video clips helped them understand Tourette's signs and symptoms better. Many students reflected that having a good supporting system helps alleviate the syndrome, while a limited number of students mentioned that it helps patients be more at ease with their symptoms. A student wrote, "When I learned the topic of tic disorders in class, I couldn't imagine the symptoms or behavior of patients with tic disorder. Brent makes me understand more." Now, what about empathy? One of the core elements of professionalism. Students reported that they empathize with patients. They assume that patients may feel bad. The factor that a lot of students empathize with is that tics are out of patients' control, and other people may unfairly judge them for their symptoms. One student wrote, "They face many obstacles in relationship and work. I think we should respect and empathize with them." The next theme is positive attitude toward mental illness. The sub-themes include change opinion, seeing a patient as a whole person rather than the disease. People with mental illness can live normal and happy lives, and determined to be a Tourette syndrome ally. In change opinion, a student wrote, "At first, I had no idea how patients with Tourette syndrome live, but after I learned and watched the video, my opinion changed. The patient with tics can find love. They can live with their symptoms." Another student wrote, "You will see what he or she is really like, not just someone who has Tourette syndrome." Many students determined to be a Tourette syndrome ally. One wrote, "In the future, if I meet patients with Tourette syndrome, I will give good counsel and help them." The last theme is satisfaction. Many students stated that watching clips were more enjoyable and effective than traditional lectures. In conclusion, this finding points to the possible usefulness of using a reality television show to enhance students' knowledge, learning experiences, and raise awareness of the psychosocial aspects of the disorder, resulting in a more empathic understanding of psychiatric patients.